You've worked hard for what you have. Your money, your assets, your 401k, and home. Isn't it all worth protecting? Nearly 1 in 4 consumers have been a victim of identity theft. LifeLock Ultimate Plus helps protect your finances with up to $3 million in reimbursement. LifeLock alerts you to identity threats you might miss. And if your identity is stolen, your dedicated U.S.-based restoration specialist will work to fix it. Let LifeLock help protect what you've worked so hard for. Save 25% off your first year on LifeLock Ultimate Plus at LifeLock.com/aware. Terms apply.
Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hi, this is Wayne Callan for Attitude Magazine. Today's topic is one that concerns many parents: sleep solutions for our ADHD children. We are fortunate to have Dr. Lisa Shives, a nationally recognized sleep expert who is on the board of directors of the National Sleep Foundation, and Elaine Taylor-Klaus, a professional parent coach who has ADHD herself and is mom to 3 children with ADHD. Both Dr. Shives and Elaine Taylor-Klaus contribute to ADHDmoments.com, a website launched by Pfizer that supports parents of children with ADHD. Welcome, Lisa and Elaine.
Thank you, Wayne. I thought I'd start by just giving you an overview of this problem of sleep and ADHD. There's been many research articles over the years, and a recent one in the journal Sleep showed that when ADHD children have a lack of sleep for any reason, their symptoms are much worse. Their sleep is more disturbed than other children. They get less sleep. They also spend less time in REM, which we know is important for memory consolidation. So we know that good sleep is necessary for judgment and executive function, reaction times. Just very many cognitive functions depend on a good night's sleep. Elaine, do you want to jump in?
Absolutely. So, yes, as you've identified, Wayne, that sleep is this huge challenge for many families and kids with ADHD. It's a really common problem. It's complicated. And the problem is that most parents know that it's important, and they often feel at a loss for how to help their kids get this proper night's sleep that they want to have, right? That's why Making Moments created this resource for parents. It's like a roadmap with tips and strategies, and brought in a real sleep specialist to help us learn how to do it. So it's a pleasure to be here with you, Dr. Shives, and working on this. What we really want you to know as parents is that you can make a difference, that you can help your kids develop these better sleep habits. There's a lot of resources on the ADHDmoments.com website. And then what we're going to do today, as Dr. Shives identifies the challenges, is we're going to give you some how-tos, like what do you specifically need to do to make it happen. So just in this first area, the first place to start in terms of how do you make it happen is to get buy-in on a good night's sleep for your kids. We think sometimes that we need to tell our kids what to do, but the ADHD kids need motivation. They need to be bought in, to be part of what we're trying to help them learn to do. So it will help as parents to help them understand what they have to gain, to help them connect with what they like about sleep or what they like about how they feel when they're well rested, and to really have some compassion for those kids who do have trouble going to sleep. It's really hard for them and it's frustrating. So to let them know that you're going to help them with a problem so that it really feels like their problem that you're helping them address instead of your problem you need them to go to sleep. So that's what we mean by getting buy-in on a good night's sleep. Engage your kids in the process.
Excellent.
So what's next?
Well, I think we'll go over just what do we mean by a good night's sleep. So there's quality, of course, but let's be sure we're all on the same page about quantity. So how much sleep do people need at different stages of life? So the children, school-age children, from about age 5 to 12 or 13 when they hit puberty, need, on average, 10 to 11 hours of sleep to be at their very best, and some need even more. Some can use 12. It would be very, very unusual for a child to be at his or her best with getting fewer than 10 hours of sleep. Okay? They might get by, but it's not optimal. And then for adults, we recommend 7 to 9 hours. And most people, if they think about it, know what they need to feel their best. Or they say when they don't have obligations and they go on vacation and they don't use alarm clocks, they can tell, well, geez, I naturally sleep 7.5 hours and wake up refreshed and feel great. Or maybe it's 8, maybe it's 9. Very unusual to be less than 7. It does exist. It's a bell curve. It does exist, but it's unusual. And I really question people who tell me they feel super fantastic and they're getting less than 6. I mean, they're probably fooling themselves. And then teenagers, what you should know, so I did adults and I did, younger children. Teenagers need, on average, 9 to 9.5 hours. I have to put my plug in here. High schools are set up to be sleep-depriving institutions. Over to you, Elaine.
Yeah, I'm so glad you said that because that was my first question is what about teens?
Yeah.
So how do you help get a good night's sleep? We like to talk about it in terms of sleep hygiene. We talk about brushing our teeth and hygiene and keeping bathing, but sleep should be a part of that. And as parents, if we show them and don't just tell them, we have open communication with them, we set clear expectations, it really makes a difference. So what do I mean by show them? For example, when my son gets ready for bed, so do I. So as he's brushing his teeth, I'm going and getting my brushing my teeth. I'm getting my pajamas on. The added bonus for me is a great structure because if I brush my teeth early, then I'm not likely to eat later in night. I'm not likely to be drinking later in night. But more important, he sees me doing what I ask him to do. And so that gets the system established in his brain that's part of a regular pattern, just like brushing teeth and bathing.
Yes, I think that's excellent advice because you tell them, and then occasionally they catch you on your computer at midnight. They're going to grow up to be people who do the same, right?
Guilty.
So I think that modeling this is excellent behavior. So just to make the segue to more tips on sleep hygiene, so that's just a word we use for good sleep habits. And one of the most important things is creating the environment, the way the bedroom is set up to help you sleep, and it's actually based on biological needs. So 2 things we're always telling people is make sure that your sleep, the environment, your bedroom is cool and dark. Now that's not just because, that's a pleasant way to sleep. No, it's actually deeper than that. We know that as we get drowsy, our core body temperature starts to drop, and it continues to drop throughout the sleep phase. And our nadir, our low point for our 24-hour body temperature is roughly like in the middle of a sleep period. So when we're telling you to keep that room cool, I mean, we really mean this is what your body needs to encourage drowsiness and sleep. And when we say it's got to be dark, darkness is what allows melatonin, which is a kind of sleep hormone. It doesn't exactly put you to sleep, but it's associated with sleep. It's one of those areas we're still researching. But we know that if your melatonin is suppressed, you are very unlikely to be sleeping. So, and there's other neurotransmitters in your brain that are triggered by light. In fact, what everyone should come away with is the most powerful signal to your brain is light. I mean, as far as whether you should be awake or asleep. If you have all the lights on in your house at 1 a.m, your brain thinks it's time to get up and plow the fields, okay? And it's why I always am kind of ranting and raving against electronics, especially the newer ones. We're sitting so close to computers. The iPad is in our face, the smartphone. These devices emit enough light to be suppressing melatonin and turning on our wake neurotransmitters. So an hour before bed even, start having dimmer lights. Make sure the bedroom is dark and cool.
That's great. That is so helpful. And I know I'm going to have a fight in my house when I get home with this information. I know I've touched on this a little bit earlier, but I want to talk about setting clear expectations. So in order to do what you're talking about, we need to have clear systems and clear expectations. And we want to make sure that everybody knows what's expected of them. Bedtime is at 8 or 8:30, light or in bed at 8, lights out at 8:30, whatever it is. But we also want to make sure that our household routines are supporting this really good sleep environment. So if dinner is at 6, then 8 may be a reasonable bedtime. But if you've got an older child who's doing sports and they're not even home till 9 o'clock or till 7 o'clock and dinner is at 7:30, then you may need to shift things in the house so that the bedtime matches the whole schedule. Now, having said that, parenting is about conscious trade-offs. So bedtime is a priority, and that may need to be more of a priority for some families that have different age kids than other priorities like family dinner. It may be that a couple of nights a week, if you've got an older teen who's got late nights, that you still want to keep feeding your younger child earlier so they can make that earlier bedtime, because you have to meet the needs of each child in the context of the whole family. So really getting clear on what's expected with everybody and then setting the schedules that work for the whole family system really makes a difference.
Good advice. One thing that I'm often asked about is, when we're talking about creating a good environment and creating a buffer zone between the busy day and going into the sleep period, that you want to have a time of relaxation, about an hour before bed. But people will ask me, well, then does that mean I can't exercise, at that time? The age-old wisdom from sleep medicine specialists was always that you should not do cardio, real exercise near bedtime. There's been some recent research that questions that and challenges that, and it's one of those things where I say, why don't you experiment? Why don't you see? Because I know, Elaine, you said that you have stories where you actually think that a little bit of physical exertion actually helps calm down children with ADHD.
Sometimes, yeah. For some kids, it can release just enough dopamine for the kids to settle down a racing mind, or to quiet down, bouncy legs, and help them sleep. And I don't mean a lot, but, some push-ups or pull-ups or something just to sort of calm them down, actually.
Again, I think that is something that families can experiment with. You can keep a sleep diary, and you can say, for a week or two, we did this before bed, and how do I think the night went? How does the child think the night went? And just try to experiment. And even for grown-ups, it's the same thing. They can, in this day and age when it's so hard to fit exercise into our busy schedules, I'm really loath to tell someone they can't do it at a certain time of day.
Right.
So give it a try. We definitely know that, of course, that something more like stretching or yoga type exercise very near bed can be very relaxing to people.
Right, because it's got that more meditative quality. And, any way you look at it, what you're talking about is really about finding the systems, the strategies, the rituals that work for you. I'm a big fan of rituals, especially for people with ADHD, because it sort of helps us not have to remember too much. But with clear expectations and a little bit of planning, if you know what the routines are, and you'll vary them some, but to know that that you've got quiet time or lights start dimming, and then bath time, and then reading time before lights out, to sort of so that you know what to expect and your kids know what to expect, and whether it's soothing music or taking baths, or I'm a huge proponent of reading to kids before they go to bed. The routines are going to vary. It may be sometimes when I snuggle up with my son at night, he asks different questions, and we get into a ritual of asking questions, and that may change. Or sometimes I'll read it to him, and sometimes I'll tell him stories. So there may be variations, but generally speaking, I try to hold the time consistent, and I really believe in holding the energy consistent. As you're pointing to so clearly, to begin to slow it down and to bring down the energy and bring down the lights really sets the tone for a beautiful night's sleep.
Yes. Are we ready to do some questions?
Yes, let's take some questions. That was excellent information. Great setup. Loads of questions about melatonin, all kinds of them. Melatonin has been a magic med for our 12-year-old son. However, I am concerned about long-term effects of taking this hormone. What's the latest research/news on long-term effects for patients?
I don't know that there's any latest, and I don't know of any evidence that it's harmful. The one caveat is, especially because you mentioned it's a 12-year-old boy, there's evidence, I think pretty weak, but it is a theoretical concern about how melatonin could interfere with the pathway of testosterone production. And so many people will not use melatonin, will not, recommend it in a teenage boy. Once they get kind of college age, it's back to that it's okay. So you might want to discuss that with your doctor. The other thing is that really the research shows that it's better to stick with very low dose melatonin, and I mean like 1 milligram or even 0.5 milligram. And I know that the tablets out there, many times they come in 3s, 5s, 6s, and people are taking between 3 and 10 milligrams. So those are my recommendations: is do discuss with your doctor the fact that your boy's probably getting, hitting puberty or getting near it.
So let me this is Elaine, just follow up on that. The other thing about melatonin is that it's time related. You need to take it at least half an hour before you're expecting to go to bed, if I'm correct. That it's not something you can, take right before you go to bed. You need to plan for it. Is that correct?
Right. Well,
yeah.
That's true, and that's actually true almost of any sleep aid that it usually takes about 30 minutes to feel any effect. But melatonin's interesting. The research shows it's actually more powerful as a circadian rhythm modulator. There's this fancy word for, instead of being this kind of drug that you take it and you just you start to feel drowsy and you conk out. That it can help reset your 24-hour clock. And and this is often for people who they actually can sleep just fine, but they want to do it, they want to go to sleep at 3 a.m. and get up at noontime. So they have a delayed sleep phase, and our society is not set up for that. So we're trying to shift these people to an earlier bedtime, and this often starts to happen to people in the teenage years. And it's actually natural. Again, this is why our high schools are set up in a disastrous way, is because it is natural for teenagers to not feel sleepy, until later. I mean 11, 12, 1 a.m. So when we're trying to shift people to an earlier time, we actually use melatonin very differently, and we give it 5 to 7 hours before desired bedtime. Now, I do want to caution is that if you're going to start, that sounds like a good idea. You really should maybe have a sleep specialist helping you if you're going to start trying to use melatonin in what I would say is a more sophisticated way. Because
and I think what's more typical with ADHD parents is that they hear from other parents, this might help. I'm having trouble getting my kid to sleep. This might help. And so it tends to not be something that's always done in concert with a doctor, although a lot of psychiatrists will include it as part of their management.
And it is over the counter, so, that leaves people to think, that you can do whatever you want. It's interesting that I know in Germany it's considered a prescription medication. So, I always caution that people should still take over the counter seriously.
Yeah.
Another question relates to melatonin. My children take clonidine and melatonin now to help them fall asleep. I'm concerned about the long-term side effects of taking a blood pressure medicine. Is there a natural alternative, such as 5-HTP, that works just as effectively?
Well, I do have to say, I know what you mean about being worried about the clonidine. We don't like anybody to be on a medication forever if we can help it. But the evidence for 5-HTP, just to let you know, there's not much evidence that it's very effective. I guess I would say, could you try just weaning off the clonidine and seeing if only the melatonin can do the job? And the other thing that I try to do with anybody with a medication is use the medication to try to reset, the internal clock and the sleep schedule, and then try to wean them off because perhaps their natural sleep-wake cycle is back to more of a normal cycle.
Well, and I just want to reinforce what you said, which is that this is really complicated stuff. And what I always caution parents with any of this is don't try to make these decisions and figure this out alone. Do this in concert with your physician. And if you feel like you have a physician, that if you want to look at a more natural approach and you have a doctor who's not inclined that way, you may want to find a different doctor, because there are definitely psychiatrists out there who are using some of these alternative approaches and understanding sort of on that cutting edge, sometimes even a step ahead of the research, because anecdotally they're seeing that it's working with their clients.
Right. And
That's
and
good
again,
advice.
Some of this, doctors always taught to think of, risks and benefits. And if the risk is very low, which I think with something like 5-HTP, the risk is low for you to go ahead and give it a try. That's one thing. But since he's on other medication, you should first discuss it with whoever's prescribing them.
And that's the argument for prescribing a physician who really understands this issue and this challenge. What we see a lot happening is pediatricians who are very well-meaning, who are putting their children on ADHD meds or other medications and don't really have the level of expertise that a specialist would have to manage it as consciously and intentionally as this realm needs to be managed.
Yes, I agree.
Here's a question from Kyle. What does an ideal bedtime schedule look like for an ADHD child?
Well, I think the answer to that, Kyle, obviously depends on the age of the child, as well as how the ADHD shows up. So you really want to look at what are the challenges, what are the struggles, where is it a problem, so that you can identify a ritual that will meet the individual needs of that child and of that family. As Dr. Shives talked about earlier, having just a clear time frame, having the energy begin to shift an hour before bedtime, low light, soothing music, those kinds of things can be helpful. But if your child loves to hear stories, that will tell you something about how to design a bedtime that might be different from it if your child loves to tell stories. So you really need to do it individually by child and by age. That being said, the short answer, that's the long answer. The short answer, I think, is downtime, PJs and pajamas and teeth brushing, some downtime, some reading or conversation or connection time, and then lights out. Anything to add, Lisa?
I want to throw in there and maybe you do, along with teeth brushing, a lot of people bathe a child every night, and I told you that I jumped into parenting because I adopted an 8-year-old.
Right.
And I'm like, an 8-year-old, she's not stinky or anything. Do I have to bathe her every night? But my mother, who's living with me, is my nanny, thanks be to God, said, no. Now listen, I believe it calms them down, that nice warm water. And then the sleep specialist in me said, wait a minute, that's right. We recommend hot baths to lots of people, and guess why? Is that actually, to go back to my earlier theme, when you get out of doesn't have to be a bath, but when you get out of a hot bath or shower, you're hot, but then you start to cool down, right?
Cool down.
And it's that cooling down. I mean, I do think the nice hot water, and it can relax a person, but then the cooling down helps encourage that drop in the core body temperature.
So you want to do it really not before dinner, but right before getting ready for bed.
Yeah, make it more kind of in that 30 to 60-minute before bed ritual. And also I want to put a pedagogical plug in here, is that reading, I was, since I had to learn really quick what to do to help a child, she didn't speak English, I was reading that there's good evidence we should read to a child way past the age where they can read to themselves. Because we actually will read at a higher level. I mean, the books that we read to them, we're able to do a higher level. And even though they would struggle if they had to sit there and read it to themselves, of course they can take it in when we're reading it to them, and it actually really helps their own reading skills. So
yeah, it has a huge dramatic impact on vocabulary and future test scores and all of that, the more that we read.
Right.
You know, my son is now 12, and I can't say I do it every night, but we've always got a book that we're reading together. And sometimes it's a book actually interesting that he's already read, but hearing me read it, he gets something different from it than when he's read it himself, because we like to read these action series.
I wanted to get to some questions about Benadryl because lots of readers, participants have asked it. One specifically, we started to give our 10-year-old daughter Benadryl, 1/2 of a 25 milligram caplet, to help her fall asleep and stay asleep. Is this inappropriate? Without adequate sleep, she is quick to get angry and overreact.
I mean, I think so. An over-the-counter antihistamine like Benadryl or diphenhydramine is the generic is off, and I think many pediatricians use it and would say it is okay to try it, and keeping it very low dose, watching, how she is when she wakes up in the morning, how the child is, making sure that there's not a drowsy effect that doesn't, take her into the day. It is something that we use in children. Almost nothing is ever approved for children. I think parents are aware of that, right? Meaning, because they won't test anything in children. But pediatricians do use it, and so if you think this low dose is effective without consequence, but please do make sure that your pediatrician, or if you have a psychiatrist that's helping you with ADHD, make sure one of your doctors knows and approves.
Can I ask you a question on that? Because I got a notice actually from my health plan's bulletin or whatever, and that was talking on this issue, and it said that the antihistamines taken over time can actually lead to difficulty sleeping. Is that correct?
Well, I wonder if they mean almost everything that we use for sleep, a person will develop tolerance and dependence, and which, you try to not take it one night and your sleep is way worse. It will normalize, as I tell my patients. It'll go back to your normal kind of, bad level, but it can be way worse. So, it's not forever. The one thing I always caution about the antihistamines is we know that in seniors it can have a paradoxical effect, meaning they're wired, they're swinging from the rafters. Benadryl was the most common sleep aid used in hospitals years ago, and now, it's just drilled into your head as a young doctor to never use it. You'll just make most of these older, sick people completely wacko in the middle of the night. Don't use it. And so I wonder, and I know, Elaine, you and I talked about this, that we always have to keep in mind that perhaps with ADHD, there can be paradoxical effects to medications. And that, if you were just brand new to this topic, you'd say, why would you give a stimulant to a child who's, running around, can't focus, can't sit down, hyperactive? Why would you give a stimulant? Of course, we do actually know how it works, in the frontal cortex, and it encourages focus and etc. But at first blush, you think, oh no. And so I would keep that in mind. Is there could be many of the ADHD children, it might actually make them more hyper, make the sleep more difficult.
Yeah, I think that's a really great point. But, as parents, our job is really to be the case manager for these complex kids. And as such, we have to look very methodically at what's working, what's not working, and be able to shift and change and report back to our doctors, to our medical team, and also to know that it's going to change. And just because it's working now doesn't mean it's necessarily going to be working a year from now or 2 years from now. So we have to be really nimble and able to pay attention and then change our approach, which can be really hard because that's half of our parents of these kids also have ADD. So it's putting a lot of expectation on parents, which is really challenging, to hold them accountable to that level of management when it's hard for them to manage themselves. Really, it's complicated.
Another question about snacking. Does snacking too close to bedtime cause restless nights for children with ADHD, or any child for that matter?
I'm going to have to defer that one to Lisa because I really have no clue, but I'm very curious about the answer.
In general, we discourage too much eating near bedtime. Mm-hmm. To have a full stomach, it can promote, reflux, GERD. That's not good. Also, the more we know about energy metabolism, meaning, how human beings manage their weight and how they metabolize food. We actually know, it's so funny, like your grandmother could have told you this, right? That you're supposed to sleep when it's dark, you're supposed to eat, mostly in the light hours, right, from morning till 6 or 7. Your hormones and other kind of enzymes are set up with a circadian rhythm, meaning a 24-hour rhythm, and they don't function properly. So you do not metabolize food the same way when you're eating it at 10, 11, midnight. And of course we do know that eating later at night is associated with weight gain and obesity. So no, you shouldn't be eating too much. But at the same time, if you actually have a gnawing hunger, that could keep you from sleeping. So I tell people, this is I swear it's probably what your grandparents thought. Like cheese, maybe a little bit of a cracker. But the thing about cheese that I like is it's mostly protein and fat. So, and that's good. I mean, that will cut hunger faster than carbohydrates, and it will keep you feeling full longer. So you want to avoid carbohydrates, so meaning starches and sugars. Avoid that if you're going to have a little small snack.
And what about people who take medication at night who need food in order to take the medication? Same thing?
Same thing, little piece of cheese. The one thing about cheese and people who struggle with weight, a 1-inch slice of cheese is good, but they got to be careful. They'll eat the whole brick. If you have, right. So they have to be careful about that because it is calorically dense, of course, cheese.
Mm-hmm. Right. One parent is writing about her daughter and anxiety. She says, my 10-year-old daughter often wakes between 2 and 3 in the morning. She is wide-eyed and awake for about 2 hours at a stretch. She's done this since she was a toddler, off and on. She also has anxiety and needs comfort and reassurance to get back to sleep. What can I do?
Oh, God. I probably would have been on Oprah's last show if I could tell you how to fix that problem.
I was going to say, go to a sleep specialist.
Yeah, it would be a lengthy conversation about how to help the child. There are cognitive behavioral therapies that are meant to help adults with insomnia, and we do try to use some of those same techniques with children, but I know that finding practitioners of that can be difficult. Mm-hmm. Of course, there's well-known books by Ferber and Weisbluth are two big names about what to do, especially with this. This is a type of insomnia in children, especially where and what usually happens is the parents set up a way of dealing with the problem that can actually often exacerbate the problem. Mm-hmm. So that, if you're saying you need to go in and comfort her, then now that becomes a kind of self-fulfilling kind of bad habit. Right. Yes. And I know that I'm sure people have heard of Ferber, who's, the basic, the book's 300 pages, but if I can give it, the basic message is, just shut the door and let the kid cry, right? God, I hope he's going to get, but there's modified, ways, and I know that seems really harsh for many parents to just let a child suffer in any way and have anxiety, but there's modified ways to deal with it. But again, it would be a lengthy conversation. I don't know, Elaine, you want to jump in?
I think what I would add to that is that there is a piece of this that's about your child's challenge, but there's also a piece of this that's about how you manage it. And so, as a coach, what I would do is work with the parent in this scenario to identify, to get really clear on what the patterns are, what's happening, and as you point out, Lisa, what the parent is doing is helping the situation, and where sometimes we parents get in our own way. And so where that's happening, and begin to shift and modify. It's not something that's likely to change overnight, no pun intended. But it is something that we could begin to work with a family to help modify the parent's approach to the situation to begin to get different kinds of results. And if nothing else, if you're a parent who is up for 2 hours every night, you're not getting the sleep you need to be the most effective parent that you need. So we've got to come up with a way to make sure that you as the parent are getting the sleep that you need, even if that child is struggling with it, to find other ways to manage that. So to me, this is a management issue. Yes, there's a medical piece, and I would definitely send you to a sleep specialist. But there's a management issue here, and that's what we would coach a family around, coach the parents around how to manage it in a way that's optimal for the family.
Right. And I think you touched on a great point that we had wanted to emphasize in this webinar, that because mostly we have focused on the children's sleep, but that it's really important that the parents, protect, not just because they're going to be good modelers of this behavior, but that they need to be at their best. They need to be well rested and at their best to be a great parent in the daytime. So they should be protective and concerned about their own sleep.
Right. And on my company is Impact ADHD, and on our site, everything we do is done in the context of self-care for parents. Every week we have a self-care tip, because really, if parents don't take care of themselves, and I think the Making Moments site is definitely about this as well, that if we don't take care of ourselves, we really can't be the kind of parent we want to be for our kids. And we're going to be melting down just like they're melting down because we're tired or we're hungry or we haven't had any exercise. So thanks for bringing that up. You're absolutely right. It's a critical piece of this whole puzzle.
Right, and you're right. We should get it out there that ADHDmoments.com, that much of the advice is to help the parents with sleep.
Right.
Yep.
Right.
Okay. Well, we'll have to end it there. Thank you very much, Lisa and Elaine, for such an informative webinar. I learned quite a bit.
Thank you. I did too. It was great. Thanks for having us.
Thanks.
Have a good day, everyone.
For more Attitude podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.